Hello, this is Charles Epstein from the Catalyst Podcast. Today we're joined by Dr. Tess Drazdowski, a research scientist with Lighthouse Institute, to discuss her innovative work on substance use recovery for emerging adults and her journey in the field. Tess brings a wealth of knowledge from her research, hands-on projects, and personal experience. So let's dive right in. Tess, welcome.
Hi, Charles. Nice to see you.
Same. So you are based outside of Lancaster, Pennsylvania. When you look out your window as we speak, what do you see?
So very fortunate. We just moved here a little over 2 years ago, and I have the pleasure of looking out onto beautiful farmland and rolling hills, and right now some cloudy skies and not a lot of leaves on the trees.
Very nice. And the temperature is?
Ooh, good question. In the low 40s, I think, today.
Oh, okay. That's not too bad.
Not terrible. Not as nice as, when I was living in LA, but I'll take it.
Nor is Boca Raton, Florida, where I currently am. And this time of year, I always emphasize that. There's a brief window where living down here is absolutely really good. That's not always the case. I'll be the first to admit. Any case, Tess, I know you're real busy, so I do appreciate you taking the time to talk with us today.
Hey, you're welcome.
So let's begin. Take our listeners through what it is you do, what your work is all about at Lighthouse, and what led you to focus on substance use recovery for emerging adults, which is to say those between 18 and 26.
Yeah. I love to do that. So my work as a research scientist and licensed psychologist is currently focused on how do we get more substance use recovery services that are backed by research or evidence-based to the people that really need them. So earlier in my career, I was interested in little ones and then adolescents, and now emerging or young adults, like you were saying, that 18 to 26 age range. So I joke that apparently my age of interest keeps aging with me as I get older here. But my current focus is on this age group because we just see so much need there. So emerging adults are the ones who are using substances the most. They report the most problems because of their use, yet they are the ones that are the least likely to engage in treatment services. And once they begin services, they're the age group that's the most likely to drop out. And since we know that the earlier one enters recovery, the better outcomes they have, I really want to help figure out ways to make substance use services engaging, helpful, and accessible for this population.
You know, Tess, having spoken to you before, your passion for working with or people simply who are in the criminal legal system is palpable in anybody who's familiar with your work. It's inspiring. Can you tell us a little bit more about your experiences teaching child development classes in prisons, which is amazing to me, and how that shaped your perspective on the overlap between substance use and incarceration?
Yeah. So while I was in grad school, I had the fantastic opportunity to teach these child development classes in both men's and women's state prison facilities outside of Richmond, Virginia. It spanned different security levels. And the course I was teaching was actually developed by this wonderful individual while she was incarcerated as a parent to teach others. By the time I was working with her, she had been released and she was now employed by the Department of Corrections to provide these classes. But being fortunate to come from a family where when I was growing up, I had no criminal legal system involvement, it was really eye-opening to see the system from the inside and not just from what you see on TV or in the movies.
Sure.
And seeing really all those injustices that happened both within and also once someone was released firsthand just really stoked this passion in me to help in any way I could. Also, just sitting with these parents and hearing their stories and how much of their incarceration stories overlap with substance use, particularly in the women's prisons, it really made me want to focus my work on this population and also try to figure out ways to intervene and help people before the criminal legal system involvement happens too.
You're currently involved in two fascinating projects, training emerging adults, peer workers, and or parents in evidence-based practices, including an incentive-based program you refer to as contingency management. For our listeners, if you would break down what these projects entail and their goals.
Sure. So these two projects are pilot projects, which means they're smaller projects that are just in the initial testing phases. And in them, I am using contingency management. And I'm trying to see how that model could, one, be more developmentally appropriate for emerging adults, in part by focusing really on their social support network. And also how contingency management can potentially be used by other change agents, like you mentioned, like peer workers or parents, instead of just therapists. For both of these projects, the goal is really to test out these different service models, these different research designs, and get feedback about what people like, what we should change, and do all of that before we apply for more funding to test them out on a larger level to see if they actually work based on numbers and statistical analyses. So the first of the programs is called PEERS, which stands for Peer Education Empowering Recovery Support. So in this project, we're working solely with emerging adults. So what we're doing is we're training volunteer emerging adult coaches who may or may not have direct lived experience with substance use recovery and or criminal legal system involvement to use contingency management and vocational educational skill building to help other emerging adults who are currently struggling with substance use and have had involvement in the criminal legal system to reach their recovery goals.
Tess, let me just stop you there. I just want to make sure our listeners fully understand what it is you mean by contingency management, what that model entails.
Sure. Yes. So let me jump to explaining how it works. So contingency management, it's also called CM for short. It's a therapy approach really rooted in behavioral psychology. So on its most basic level, it's giving someone an incentive after they engage in a wanted behavior. So CM is actually used everywhere. So for example, our company just gave out gift cards for people who enrolled early in our annual benefits election. My car insurance company gives me monetary rewards because I allow them to track my mileage and my driving behaviors. The less I drive my car, the more safely I drive it, the larger discount I get on my insurance. When it's used for substance use, like in the programs that I'm doing, the behaviors that most frequently are rewarded by gift cards or other incentives in CM are things for testing negative for substances on a drug test or attending your treatment sessions. The VA, or the Veterans Affairs, has been using this model for a while, as it is one of the most well-documented successful treatments for substance use disorder, specifically for substance use disorder, where there's really no other options, good options for treatment right now, like medications, or really anything beyond talk therapy types of services. That's broadly.
Let me ask you a question, Tess. My understanding is that for a while, contingency management, there was some stigma attached to it. Maybe that's a reason why programs based on it were traditionally underfunded. Why is that? It appears that that's changing. Yes?
It is changing. So there are several reasons why it's had stigma around it, why it's been underfunded in the past. So one is just broad misconceptions about addiction. So some view addiction as a moral failing, right, rather than a health condition. So this leads towards resistance about rewarding individuals for something they perceive as people should simply be doing what they should be doing already, right? Mm-hmm. There's also concerns about bribing people. There's a misconception that this is what CM is doing. But it's more about providing these incentives to support behavior changes. I was telling you about, making that analogy about before, especially for people in the early stages of recovery, right? When your brain is really just having to do a lot of rewiring to do. And if it was just easy to stop substances, I think we would see people doing that, but we don't, because it's not. It's really, really difficult. Drugs are incredibly powerful reinforcers, and we need something to compete with that. I think the other thing that we see is there's really historically been a focus on punishment over reinforcement. We really see that in the criminal legal system. And like I was saying, my experiences in the prison systems as well, right? That big overlap that we see for people with substance use disorders being involved in the criminal legal system. That's actually the way most people find their way to treatment services right now. So that can make it hard for people to shift that mindset to a reward-based kind of program. And finally, there are cost concerns. It uses those often monetary incentives to help people with that extra motivation. And so why it can be cost effective in the long run, you do need resources to get it started. And so sometimes that can be a barrier for people as well.
No, that makes perfect sense. In a previous conversation, you mentioned a recent push to support contingency management for stimulant use disorder. Why is this receiving more attention now? And how could what you're doing around this make more of an impact?
Yeah, I'm so happy you asked about this. I think it's receiving more attention, quite frankly, because people are dying. I mean, while the numbers are finally starting to recede, approximately every 5 minutes, someone is lost to a fatal overdose. And these deaths are largely the result of opioid and stimulant use. Just last week, however, like a long list of national organizations like the American Academy of Addiction Psychiatry, the American Society of Addiction Medicine, the National Council on Mental Wellbeing, Addiction Policy Forum, and others sent a letter to urge the administration to lift. There's a current 75 max restriction on many federal programs on incentives for contingency management for stimulant, opioid, and other alcohol use. They're asking them to please raise that. I'm hoping my projects can basically add to the decades of work in how to help people in the recovery goals using the strength-based approach and expanding who could learn these types of models to meet people where they are at to get services, particularly among emerging adults. So I'd be happy to go back and explain what some of those projects are trying to do.
Sure.
So I think I was mentioning the first project, which was called Peers. And that's where we're working with all the emerging adults.
Yeah, I'm sorry. By the way, I did
okay.
sort of short circuit you because I thought it was important for our listeners to get a real good idea of contingency and plus some of those stigmas, because they're not at first blush intuitive, but when you walk us through it, it makes perfect sense. I'm sorry. So now we brought you back to where you were. So just wanted to set that stage for you.
No, I think it is a really important topic, and I hope people listening potentially even do their own research to see what's going on and do any kind of outreach they feel is appropriate to help with that. My work for that first project, I'm really interested in answering questions about like the peer work first, about like direct lived experience, what's the importance of that, also the secret sauce for that, and also really just seeing if having community-based services provided by similar aged individuals is something that would be more attractive to emerging adults who've been involved in the criminal legal system in those early days of their recovery journey. So that's one. The other project that I'm leading right now is called Launch. In this project, we're taking a different approach. Here, we're recruiting emerging adults who have a supportive parent who is interested in helping their adult child with their recovery. So in this project, we're testing 3 different service models. One, where the emerging adult only meets with a peer worker who's received some extra training from us and support in educational and vocational goal setting and skill building. Or just the parent meets with a virtual coach to learn about contingency management skills to see how they could potentially implement that within their family unit. Or both get services. So both the emerging adult and the parent get services, those services I just described. In this project, we're also targeting rural areas. And so we're just trying to see can we teach parents these skills? Is it really the peer worker in-person piece? What pieces of the puzzle might be most helpful and for whom? And hopefully that can guide our future work for where to put limited resources.
I'm assuming each area where you are putting those resources has their own set of challenges. Are there 2 or 3 that are shared across the board? Access, what are some of those shared challenges across the board that you've been encountering?
Yeah, I think engagement is the real big one. I think we can all think back to when we were a young adult between 18 and 26. And just that whole like feeling invincible, this really isn't a problem, the whole like maybe that's someone else, it's not going to happen to me idea. I think there's a lot in emerging adult culture. So we have some community boards that I've been fortunate to work with as part of a project that I'm on called the Jeep Initiative, led by Ashley Shido and Mike McCart. And with those boards, some of the emerging adults really talk about how it's such a part of the culture. Substance use, just broadly, it's something you're supposed to be doing. It's seen as everyone does it. And you look at the movies, there's always the red cups in the movies, right? And that's a big part of the culture. And so I think it can
Can I
be,
ask you a question?
yeah.
I'm sorry to interrupt. Let me ask you a question. It never really occurred to me for some reason to ask this. In our culture over the last handful of years, I think there has been a lessening stigma as it relates to being more forthcoming about grappling with mental health issues.
Mm-hmm.
Clearly,
Yep.
substance abuse is part of that. But I wonder if, because I'm listening to you and I'm thinking, okay, emerging adults are part of this broader culture. They see these trends where some of their heroes, athletes, singers, artists, and so on and so forth, are being more forthcoming. But maybe substance use disorder, is still a difficult thing to talk about. It still sort of is relegated to the margins and the shadows.
100%. Yeah, it still is. I think there is movement, which is great. We're seeing things like Dry January, and we're seeing some like celebrities come out and talk about their experiences with dabbling with recovery and sobriety and how that's been helpful for them. We're seeing the pop up in major cities of like recovery friendly bars and places that don't even serve alcohol but give you that social network that's often in those types of places. There's a huge uprising, right, with peer workers, recovery community centers. And so I think there is movement, and I still do think there's a lot of what's called NIMBYism, or not in my backyard. I just experienced it recently where I live, where people still don't want to bring necessarily places of recovery into their communities because of the fear and stigma around the individuals that would be getting services there, and a lot of misconceptions and miseducation still around that.
Yeah, yeah, no, exactly. Any case, that wasn't the first time I interrupted you.
Oh, you're good.
I'm thinking it was I hope that they were productive interruptions, but, you're going through some of the other projects and programs. I just want to make sure you have an opportunity to talk about all the
Yeah,
things that you're working on. And as we're about to enter a new year, maybe there's some other things you got teed up that are particularly exciting.
that is true. Yeah, so yeah, that is a review. I definitely got to hit on all the things that I'm currently leading, which is great. And I do have things up and coming that I'm so excited about. We'll see. It is all dependent on what my peers and the federal government decide to fund at this point. But I do have some work that's looking towards working within the criminal legal system to help emerging adults. So some of the stuff I talked about is either once people are out or before they enter, right? But actually working within the criminal legal system to train probation officers in contingency management and give them some skills themselves for how to engage emerging adults and help them with their recovery goals while they're there. That really interests me. I mentioned how my one program is interested in rural populations. It is a population I'm interested in because, again, there is such a lack of services in those areas. But we do know that there's actually probation parole officers in almost every jurisdiction of the nation. So it's a great place to potentially intervene and get people some access to services that they might not have otherwise. And we have done some pilot work on that in Oregon, which is super promising. So hopefully we'll be getting maybe in the future some funding to look at that on a larger scale to see how that could work and help support people in that way. So that's like a big one that's been on my brain. We've got some other work in the hopper as well, really about bringing people with lived experience into the whole research enterprise, like across the board, having them help us develop the research ideas, be part of the process, help us with the dissemination, figuring out results. I mentioned those community boards. That's the way we often do that. But really working with the communities where the services will be provided and with end users to make sure that what we're developing will actually work for them, not just doing this in a bubble.
All great stuff. Again, as I mentioned, we are on the cusp of a new year, so maybe I'll give you an opportunity to go out with some thoughts about the coming year, what you're looking to see, how you see this entire field evolving in the area of substance use recovery, particularly as it relates to emerging adults and evidence-based programs, obviously continuing to evolve, contingency management, based approaches. I mean, I'm actually giving you the stage to say anything you can possibly summon to end this on a spirit and a note of uplift. I know that
That
that's a
sounds,
big ask, but I know that you can
oh,
do
I'm
it.
happy. I can do it. I can do it. No,
Excellent.
I really happy to do that. I do think this time of the year is a great time for reflection and thinking forward and future hopes. And, while these are big, my biggest hope is, we touched on this a little bit earlier, but is to end the stigma around substance use struggles and the really outdated belief that misusing substances is a moral problem only to be solved by like willpower, tough love, or waiting for people to hit rock bottom. I recently met a colleague who disclosed how when her emerging adult son was struggling with substance use, no one showed up at her house like bringing a casserole, right? And that really stuck with me. How there's this vacuum of support for people, both who are experiencing it, but also their loved ones as well. And how do we create support networks that are more helpful? So while we still have a really long way to go, like about developing and making evidence-based practices more affordable and accessible for emerging adults and their loved ones, I really do believe that this work will continue to be 1,000 times harder if the current stigma around it continues. So I do want to give a thank you, a little plug, like all the amazing people I currently work with who have the privilege to live their recovery out loud, to help reduce stigma and create pathways for others to do the same. I just work with so many amazing people who are doing this, and I see the impact and how it's having this downward effect, and it's great. And I hope that with this reduction in stigma, there's like a shift in creating treatment systems that are beyond the criminal legal system, right? To be the most common way that people find their way to substance use services and to recovery. I mentioned how there's this great work happening with peer work, recovery, community centers, and I hope that these types of services continue to be welcomed, supported, and expanded to just help the millions of people out there who are currently struggling with substance use problems, to find the way that recovery works best for them.
Beautifully stated, Tess. To my credit, I know how to get out of the way. So thank you for that. Really do appreciate, as I said at the outset, I know you got a lot going on this time of year. Do appreciate you spending some time and sharing with us some of the particulars of your amazing and important work.
Well, thank you. Thank you for giving me the time too and the platform to do that. I really appreciate it as well.
No, this is great. Today we spoke with Dr. Tess Drazdowski, a research scientist with Lighthouse Institute, to discuss her innovative work on substance use recovery for emerging adults and her journey in the field. She joined us today from outside of Lancaster, Pennsylvania. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.